My name is Kim Ottley. I'm the Vice President of Public Policy for the Chamber of Commerce of Southwest Indiana. Today I have the pleasure of interviewing Senator Vaneta Becker, who is candidate seeking re-election to the office of State Senator. Please note that the same set of questions will be used for both candidates running for this office. Welcome, Vaneta.
Thank you. It's nice to be here.
Nice to have you here. Okay, let's get started. For the record, let's have you state your name, the office that you're seeking, and your current position or employment.
I'm State Senator Vaneta Becker, and I'm running for re-election to the Indiana State Senate. And I also am a real estate broker with FC Tucker and Muni Realtors.
Okay. Vaneta, if re-elected, what would be your top 3 priorities, and how would you seek to fund and implement those priorities while serving in the state legislature?
Well, I think one of them would be the completion of I-69. It's very critical. It's something that I have worked on for many years. In fact, former State Senator Greg Server and I had authored a bill that passed that actually several years ago that kind of helped to get it propelling and going. Was a $50,000 study of I-69, and I have been a strong advocate for that ever since, because I recognize that the majority, all our research shows that the majority of new businesses or existing businesses locate either on an interstate or within 10 miles of an interstate. So I think it's critically important. I also think that early childhood education is critical, and it's something that Southwest Indiana, I think we recognize and we care about, and funding is an issue. Because currently Indiana does not provide any funding for pre-K programs. And I think it's an area, we're one of 8 states that doesn't provide any funding for pre-K programs. And I would like to see us at least start pilot programs in that area. Because the majority of a child's brain development occurs between birth and 5 years of age. And they are just like sponges. And so at that age, in the early years, and I think we can do so much more to help children get off to a better start. And I think that if we would invest in early childhood education, we wouldn't have to invest as much in prisons at a later time. So I think that would be another one. And I think my third is just quality of life, and it's kind of broad in that I want to see us continue to see the IU School of Medicine grow and develop here in Evansville. I'm on the advisory board of the School of Medicine, and we are now, the state legislature, as well as IU, is looking at fostering 4-year programs, and they've actually started some funding in that direction. We have a director, Dr. Steve Becker, out at the IU School of Medicine, our regional campus here at USI, doing a marvelous job, and Rex Stiff did before him, and I think we need to capitalize on that school, because we can keep those young people. If we can get 4-year school here, we will have more opportunities of keeping those young doctors in our community, and I think that would be very advantageous to us. And also, just in general, we want to make sure that people have quality of life, that USI, that U of E, that Ivy Tech, all of we're a blessed area, and sometimes I don't think we toot our horn loud enough to actually recognize and share with people all the treasures we have in Southwest Indiana.
Great. Vaneta, do you support the Kern Shepherd initiative, and please explain your answer.
We haven't had a lot of the initiatives from the Kern and Shepherd come before the Indiana Senate. We did have, and I did support the opportunity for communities to decide whether or not they wanted to eliminate their assessors, their township assessors, and most of them did, that were on a referendum. So I think that was one plank. We also had a bill that we did pass this last session that dealt with nepotism and conflict of interest, which I supported. I thought that was a good start. I think there's others that haven't really come to the legislature yet that may come in the future. One that I did support, which did not become law, it did pass the Senate, but I don't believe they heard it in the House. It was the one that would have allowed, by a referendum, the county executives to decide on whether or not they wanted to do a single county executive. And if it would require a referendum, and I think that's what's really critical for a lot of these initiatives, is local input by voters and by citizens that live in our community. So that one did pass the Senate. It would have allowed, say, the county of Warwick County, if they wanted to, if their 3 commissioners decided that would be a better way to operate their county government, they could ask for a referendum and then it would go to the voters. So it was a local option, but it did not pass the House. So I think some of those issues will be back before the General Assembly, although neither candidate for governor, and I think that will have a lot to do with it, has seemed to be real interested in those issues at this point.
Okay. Let's see. That's about the budget, so I'll probably pass on that one. What do you consider to be the top transportation and infrastructure priorities for Southwest Indiana, and what plans do you have for funding them?
I think the most critical one is one that's ongoing, and that's I-69. We're going to have to make sure we get the final dollars to fund that project. And we know that it's going to be, we'll be able to drive on that to Crane on I-69 by the middle of November of this year, and then within the end of 2014 we'll be able to get to Bedford. And so I think once we get to Bedford, then 37 is there, and it's already on track to be improved by NDOT. So I think one way or the other we're going to get it done. And you know, it may take some innovative thinking at that point. We have been blessed with the Major Moves legislation, which is something that I strongly supported in the Senate when it passed, because it gave us an opportunity to have $3.8 billion in funding for highways throughout our state that we otherwise would not have had. And I think one area that we can continue to work would be on P3 agreements for funding. And this was something that years ago, former Representative Brian Hassler and I had worked on when we used to have a I-69 coalition between House and Senate membership when we were still working and pushing that project, and that was one of the areas that we looked at as well. And so I think those P3 agreements are agreements between state government and private companies to try to develop more infrastructure, and I think infrastructure is critical if we're going to have companies locate in our area. And that's really, I think that's our major transportation project that needs to be, because it's not going to be easy to get it finished, but I do think that I agree and strongly appreciate Governor Daniels' leadership on this particular issue, because it's so critical. For young people, we will have better opportunities of keeping them in southwestern Indiana and the communities between here and Indianapolis as well, and even northern Indiana. So I think that we have to work to continue to find the funding for the completion of that project.
Okay. And along the same lines, what would you do to encourage the construction of the I-69 bridge over the Ohio River between Evansville and Henderson?
Well, we still have some time to look at that project, because I don't think we're going to be developing that until we actually get I-69 done. But I also think we need to look at the traffic patterns of the existing bridges, just to see how long we can use those or how much traffic. I'm not sure if there's been a study done yet on that. But I think it will be something that we'll have to look at, and look at partnerships between Kentucky and Indiana as well, because it will benefit Kentucky as much. And besides, this highway is going to go south, and so I think we already see in Kentucky, if you drive the Pennyrile, they've already got the I-69 highway signs up. So I think it's something that both states are strongly supportive of.
Government doesn't necessarily create jobs, but it does create conditions that make additional jobs more or less likely. What conditions or economic development tools would you like to see improved upon or added in order to stimulate economic growth, create jobs, and retain current employers in Southwest Indiana?
I think Indiana is doing a pretty wonderful job right now in the areas of economic development. We are third in the nation in manufacturing jobs. We have, within the last 6 months, helped create 37,000 new jobs for the state of Indiana. And our growth is above the national average. It's about 1.5% versus 0.9% on a national basis. So I think we're doing a lot of that. We cut the corporate gross income tax from 8.5 to 6.5. We've eliminated the inventory tax, which was critical for growth and development. So we've done a lot of things right. We need to continue to look at the credits and tax deductions that we currently have, and I think there's a study committee looking at some of those things, that we'll be making some recommendations. I think any way we can help to less regulation on businesses that help them to prosper and to grow and to consider our state, which we have done a pretty good job at, quite honestly. But we need to continue to look at those things and see where we have things that are working. We want to help, and I think we need to do a better job to bolster existing companies as well. Maybe with job training. I think we have a lag as far as adult education and training, and we need to provide more opportunities. And I think Ivy Tech is a real critical partner in that, as well as USI and U of E, but we need to do more in that area as well.
Okay. Switching gears, substance abuse, particularly methamphetamine abuse, is a costly community problem in terms of law enforcement, crime, judicial incarceration, fire hazard, environmental concerns, child care, health care, as well as other expenditures. What changes in the approach to this problem would you suggest, and how would you find any new strategies? How would you fund any new strategies?
I think one of the things that would require no funding, but would really be a help, would be to consider, even if we could do it on a local basis, as a local option, to require prescriptions for methamphetamine products, because the majority of states that have gone in this direction have seen a big decline in their meth problems. And so I think Representative Bacon carried a bill this last year, and he didn't get a hearing in the House. We talked about trying to amend it into a Senate bill, but we really couldn't find anything that the House member, it was House bills by that time, that we could do that the House author would be supportive of. Because they really, the problem we have with that issue for us is that in Southwest Indiana, we're the worst, I think, in the state. But that is not the drug of choice for Indianapolis. It's cocaine. And so they're not as concerned about methamphetamine. And you do have businesses, the pharmaceutical companies, the retail council, which is drugstores, that don't necessarily want to require prescription. But I do think that we could, if we could just even get it as a pilot program, again, for Vanderbilt County to adopt at the local level, to choose whether or not to consider that would give us something, evidence that we could look at. And I think then it would show startling changes and reduction in meth, and we could probably then get it on a statewide basis to require a prescription. It's not, and I'm not, I really don't want to put people in harm's way or require them to have to go to a doctor to get a prescription for cold medicine. But unfortunately, this is really a crisis for us in southwestern Indiana, and I think sometimes you have to consider strong measures, and at least let's get the evidence out there to see if this works or not. And see if there are pitfalls for people, that there are some other products that can help with colds that, but I've asked physicians about this, and they say that, sometimes this is maybe the best product for their patients. So I think it's something, though, that if we could get it as a local option, would be very helpful.
Okay. Finally, what is your long-term vision for Southwest Indiana, and what specific ideas or proposals would you suggest to improve the quality of life in our region?
I think, as I indicated before, I think the completion of I-69 is critical. It can't be emphasized enough. I also think that developing our universities, all of them to grow, is a big benefit for us. The School of Medicine, getting 4-year students at the IU School of Medicine at the branch campus at USI would help us to grow and develop as well. And I think early childhood education would make a big difference in test scores, graduation rates, all of that, if we can get young people started off in the right direction in school.
Excuse me. Vaneta, I greatly appreciate your time today. If you have a campaign website, I'm sorry. If you have a campaign website or contact information that you would like to share, please do so now.
But you can see me on Facebook, and I'm also, I do have a website at the State House. It's just www.in.gov, and then go to me, and I do have a website there as well.
Okay. Thank you for your participation. Please note that the content of this video interview and all the candidate interviews are only for authorized use by the Chamber of Commerce of Southwest Indiana.